Hi, good morning, everyone. We are group number one, and our assigned theorist is Virginia Henderson. My group mates are Janice David, Jonathan Remoyan, Janelle Sabido, Lady Lorraine Salazar, and myself, Reginald Villanueva.
Virginia Henderson. She was known as the mother of modern nursing. On the 20th century, she was called as Florence Nightingale. She redefined the role and duties of the nurse. She was born in Kansas City, Missouri in 1897. She was the fifth of 8 children of Lucy Abbott Henderson and Daniel Henderson. In 1918, she entered the Army School of Nursing in Washington, D.C. and received her diploma in 1921. In 1934, she had earned Bachelor of Science and Masters of Arts degrees in nursing education. In 1953, she became a research associate at Yale University School of Nursing. In 1979, the Connecticut Nurses Association established the Virginia Henderson Award for Outstanding Contributions. Her theory background: she emphasized the importance of increasing the patient's independence so that progress after hospitalization would not be delayed. She categorized nursing activities into 14 components based on human needs. She described the nurse's role as a substitutive, meaning doing for the person; supplementary, helping the person; complementary, working with the person, with the goal of helping the person become as independent as possible. Her definition of nursing: the unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery, that he would perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. The four major concepts. First, individual. Have the basic needs that are components of health, requiring assistance to achieve health and independence or a peaceful death. Mind and body are inseparable and interrelated. Considers the biological, psychological, sociological, and spiritual components. The theory presents the patients as a sum of parts with biopsychosocial needs. Second, environment. Settings in which an individual learns unique pattern for living. All external conditions and influences that affect life and development. Individuals in relation to families. Minimally discusses the impact of the community on the individual and family. Basic nursing care involves providing conditions under which the patient can perform the 14 activities. Third, health. Definition based on individuals' ability to function independently as outlined in the 14 components. Nurses need to stress promotions of health and prevention and cure of disease. Good health is a challenge affected by age, cultural background, physical and intellectual capacities, and emotional balance is the individual's ability to meet these needs independently. Fourth, nursing. This is temporarily assisting an individual who lacks the necessary strength, will, and knowledge to satisfy one or more 14 basic needs. Assists and supports the individual in life activities and the attainment of independence. Nurse serves to make patients complete, whole, or independent. The nurse is expected to carry out physician's therapeutic plan. Individualized care is the result of the nurse's creativity in planning for care. Nurse should have knowledge to practice individualized and human care. Henderson claims that a nurse has 14 specific activities to be performed in order to have excellent care. Those activities are maintaining normal breathing, adequate eating and drinking, elimination of bodily waste, maintaining desirable posture, sleep and rest, dressing and undressing, maintaining body temperature within normal range, keeping the body clean and well groomed, maintaining a safe environment and preventing injury, communication with others, worshiping according to one's faith, helping them accomplishment work tasks, playing or providing forms of recreation, use resources to provide learning, discovery, and living.
I will talk about the fundamental ideas about the theory of Virginia Henderson. Virginia Henderson identifies three major assumptions in her model of nursing. The first assumption is that nurses care for a patient until a patient can care for themselves once again. Independence is valued here, not dependence. The care provided by the nurse is to allow the patient to take control, his or her own, and do so unaided by providing or even regaining his strength, enriching his knowledge, and supplementing his will to do so. The patient must be able to care for themselves with the basis of being able to satisfy the 14 needs. The second assumption states that nurses are willing to serve and that nurses will devote themselves to the patient day and night to help the patient meet the basic 14 needs. Finally, the third assumption is that nurses should be educated at a college level in both sciences and arts.
My name is Janice David. I will be presenting to you the case scenario, client assessment, goal outcomes, nursing intervention, and the evaluation adopting the Virginia Henderson theory. Case scenario: Miss Y, 21 years old, female client, lives in the rural area, finished only 8th grade, admitted in the medical unit with difficulty of breathing and suicide attempt. Prior to admission, father reported that she gets easily agitated, stays always in her room, resistance in eating or taking foods, and awake at night for 3 days. A week before, she also ingested toilet bleach because of family dispute. Laboratory findings, CT scan and endoscopy report revealed larynx and mouth damage. Assessment findings correlating with the 14 compartments of Virginia Henderson. Number 1 is breathing normally. Assessment findings: experiencing difficulty of breathing, respiratory rate of 32 irregular, and oxygen saturation of 87%. Number 2, eat and drink adequately. Assessment findings: she refused to take any liquid diet or food. Height of 150 centimeter and weight of 45 kilograms. Number 3 compartment: elimination of body waste. Assessment finding: Foley catheter was in place to monitor daily intake and output. Number 4 compartment: movement and posturing. Assessment findings: feeble to walk, reports fatigue and gait imbalance. Number 5 compartment: sleep and rest. Assessment finding: not sleeping for 3 days, dark circles around the eyes. Number 6 compartment: select suitable clothes, dress and undress. Assessment findings: patient appears to be wearing loose-fitted dirty clothes. Number 7 compartment: maintain body temperature. Assessment findings: no signs of hypothermia or hyperthermia with a temperature of 37 degrees centigrade. Number 8, compartments. Keep the body clean and well groomed. Assessment findings: hair is messy and untidy appearance. Number 9, compartments. Avoid dangers in the environment. Assessment findings: she is fatigued, feeble walk, and an history of suicide attempt. Number 10, compartments. Communication. Assessment findings: speech difficulty because of the damage to the larynx, resistance to share information and feelings. Number 11, compartments. Worship according to faith. Assessment findings: religion is Islam and does not attend to church or believe in the his creator. Number 12, compartments. Work accomplishments. Assessment findings: father reported that she lost interest in self-care and inability to perform activities of daily living. Number 13, compartment. Play or participate in various recreation. Assessment findings: she reported to be lost in active participation in home activities. And lastly, the 14th compartment is learn, discover, or satisfy the curiosity. Assessment findings: she's finding difficult time to cope with her stress and present illness. So the goal of the patient, we use the acronym SMART, which is specific for F, M, measurable, A, attainable, R, realistic, and T for time bound or timely manner. So the number one goal for this patient is to provide appropriate nursing care with regards to the physiological needs of the client. Number two, patient will remain free from any self-harm during hospitalization by patient will understand and agree to refrain from harming self within 24 to 48 hours of hospitalization. Number three, encourage to express her feelings. Example about why she wants to harm herself, what were the domestic problems leading to suicidal attempt. Number four is to establish mutual trust nurse-client relationship by being available and let the person know that you care for them. Number five, goal is to develop coping skills to help her handle stressful situations, like you can create by talking, drawing any pictures, asking questions, or exploring for stressful factors. Number six, goal is to encourage family support. And lastly is to encourage to participate with group activity therapy. So the nursing intervention for these patients are based on the physiological principles, age, cultural background, emotional balance, and physical and intellectual capacities of the client. The nurse or the healthcare provider should have also the knowledge and skills in dealing with this kind of patient. They should know how to handle their stressful situations, and the nurse should have be just be to herself. Let them know that you care for them. Just listen for their concerns. Be sympathetic and offer hope, and to and take the person case seriously. So our nursing interventions for these patients are: number one, the nurse will make sure that the patient is not left alone at any time during the hospitalization by letting the patient feel that she is being cared of, and always the room's patient it should be near the nurse's station. Number two, nursing intervention is to the nurse will encourage and listen to the patient about the reasons why she wants to harm herself. By doing this, the nurse can provide relief from being loneliness and pent up negative feelings to the patient. Number three, nursing intervention is the nurse will educate the family about ways of recognizing levels of impending self-harm that may be committed by the patients. Number four, nursing intervention. The nurse will assist in identifying thoughts, feelings, and behavior that leads to the patient wanting to commit suicide, which I have said before that she should have the knowledge and skills with regards to this situation. Number five, nursing intervention. The nurse will educate the patient on three techniques on developing coping skills by helping the patient to handle stressful situations, like encourage talking, participating in a group activity, or learn teach him how to draw, or show her some pictures. And number six, nursing intervention. Involve patient in spiritual activities, daily life activities of hygiene and exercise. And lastly, nursing intervention, maintain airway and pain management by giving some medications and relaxation techniques. So, evaluation of this case scenario, at the end of the patient hospitalization, the patient should be able to verbalize concerns with the nurse and showed willingness to participate in any family decisions. Patient will regain independence in performing activities of daily living with supervision if needed. Number three, open communication was established between the family members. Number four, relate the coping strategies like relaxation, recreational, spiritual activity, and family involvement with the patient and the family.
As our group conclusion, Virginia Henderson was also known as the 20th century Florence Nightingale. She called her definition of nursing her concept. She categorized nursing activities into 14 components based on human needs. Henderson used the concepts of fundamental human needs, biophysiology, culture and interaction communication, which give the theory a dynamic coverage regarding patient's need. Her division of the 14 component well addressed patient need in different domains, yet simple to apply in clinical settings. It is applicable to different dimensions of client-nurse relationship. It can effectively address patient need and elaborate nurse's role. It successfully wrapped the components of nursing process. Henderson's need theory is relevant to Maslow's hierarchy of human needs. In general, this theory is well suited and adoptable for nursing care and practice in various clinical settings. Henderson's definition of nursing is still directly applicable to professional nursing today. Nurses function to assist patients in activities of daily living, especially those who are incapable of doing so because of a debilitating condition. In our case scenario, the 14 fundamental needs developed by Henderson are very applicable to our patient Mrs. Y and has been very influential in the practice of nursing. It is very evident in the clinical settings how the nurse carries the task to assist the client in meeting her needs, may it be physical, social, emotional, or spiritual, by addressing the patient's ability to breathe normally, eat, drink adequately, and eliminate body waste as primary concerns that the nurse should address. The devotion of the nurses in the actual practice of 24-hour, 7 days a week reflects its incomparable value in task performance, for it is the goal of nursing to promote a higher level of client dependence. But in the event that they still lack the strength and knowledge, nurses act as a temporary proxy in helping them meet their needs that neither the client nor the family can provide. Using the Henderson's 14 components in our case scenario, it is very evident that her theory and these components recognize caring needs, deliver and evaluate holistic nursing care. To be specific, if Henderson's theory was not used in this case, we would definitely be looking at the fact that we have a 21-year-old patient who was admitted due to attempted suicide. This information would be the only main focus of the nurse. However, with the application of Henderson's 14 components, we were able to see that she experiences difficulty breathing, she is resistant to drinking any liquids, she is fatigued, and has imbalanced gait. She also has insomnia for 3 days now and has dark circles around her eyes. Upon further assessment, we also have assessed that she wears dirty clothes, has speech difficulty, and has not been spiritually healthy. With the use of Henderson's 14 components, our nursing care to Mrs. Y is very holistic, focusing on all 14 components. As a result, we would be able to focus on Mrs. Y's health as a whole, and we would be able to render a holistic nursing care to her rather than just focusing on one aspect of her health. In our practice, Henderson's theory assists nurses to describe, explain, and predict everyday experiences. It serves as a guide assessment, interventions, and evaluation of nursing care. It provides a rationale for collecting reliable and valid data about the health status of our patients, which are essential for effective decision making and implementation. It helps to describe criteria to measure the quality of nursing care. It enhances autonomy, independence, and self-governance of nursing through defining its own independent functions. Her emphasis on basic human needs as the central focus of nursing practice has led to further theory development regarding the needs of the person and how nursing can assist in meeting those needs. On behalf of our group, I would like to thank everyone for watching our video presentation, and we would like to end it with a quote from Virginia Henderson. "The nurse is temporarily the consciousness of the unconscious, the love of life for the suicidal, the leg of the amputee, the eyes of the newly blind, a means of locomotion for the infant, the knowledge and confidence of a young mother, and a voice for those too weak to speak." Thank you all for watching the video.